Okay, good day everybody. Thanks for joining us. My name is Peter Llewellyn. I run the activities at medcommsnet.com. Basically, what I'm trying to do is encourage people in and around medcoms across the globe to talk to each other, to share experiences and best practice, and to promote the business as much as I can do, just to encourage people to talk to each other in one way or another. So I run various sorts of meetings, and we're running these Zoom webinars now, so that we can reach out to all the people who can't join us so easily. We've got around about nearly 60 of us now online here. I'm sure you wouldn't all come to Oxford, no matter how good the food and the drink was. So thank you very much for joining in. And today we're going to hear from Peter Joshua of MMRG, who's going to talk to us about KOL stakeholder mapping. On that note, I'm going to hand over to Peter, who's going to introduce himself and talk us through a presentation, at the end of which we will have a Q&A session. So please, those of you in the audience, be ready with your observations and your questions. Peter, over to you.
Thank you, Peter, and good afternoon to everybody. My name is Peter Joshua, and I'm associated with a company called MMRG. I know the invitation went out from saying that Peter's also the CEO of a company called Thecosystems. I'll explain why there's those two companies as we go through this process. So just let me start by telling you a little bit about who we are and the company I look after. You know, we started life off as a market research agency in the early 80s. In actual fact, the acronym MMRG was Medical Marketing Research Group, doing market research by medics on medics. So that's where we started. But in the mid-1990s, a lot of our customers that we were talking to at that time suggested to us that a new and emerging field that would be interesting for us to work in would be in KOL research, not just market research in some of the KOLs, but actually trying to find out who the KOLs were. And in the mid-90s, that's where we pivoted our business, and the majority of our work now is in essentially KOL identification or KOL or stakeholder mapping. And in one sentence, what do? You know, I use the word strive here. We literally strive to make sense of public domain data. And what we try to do actually is to create new perspectives, discover unknown connections in any particular disease condition that we're asked to look at. So that's what we do. We're based in the UK and we've got an office in the US. And in actual fact, we do work globally. My understanding and my guess is that pretty much everybody in this call, we share a common purpose, and either directly or indirectly, I think we advise companies, and by companies, I mean pharmaceutical companies, biotechnology companies, maybe even medical device companies who've got an R&D asset, and we advise them on who they should be engaging in order to let the world know about their new innovations. And ultimately, I think our common purpose or our common goal is to ensure or to secure that when they bring this new bit of research to market, it is scientifically accepted by the people that need to accept it. Some people are prepared to trial it, not everybody will, but some people will be prepared to trial it. And ultimately, having experienced it, others will then adopt that new innovation. And that new innovation may be a product, as I mentioned. It may actually be an idea. And that's our purpose, and that's what we're all trying to do. I thought I would, for those who maybe don't have a perspective on this, just give you a couple of words on how this journey has gone over the last few years for our business. Talking to my colleagues, I've got some colleagues who've been here for 20 odd years. In the late 1990s, the way we did work was we bought into CDs, effectively CD libraries. And the request from most of our customers in the late 1990s was essentially to deliver them a report, a word-based report, a paper-based report in essence, and that gave them access to the data that they were seeking to understand. You know, in the early 2000s, that shifted. We could go online, we could do research online, and what people asked of us was to deliver the results as PowerPoint slide decks. And the belief was that you could better visualize what people were up to through a PowerPoint slide deck. I can take you back, if you like, and have a look at some RFPs that we received in 2005, and the request was deliver the results as a PowerPoint deck with one slide per person. That changed around the early 2010s. I think with the basically with the immersion of the industry in Viva CRM systems and many other CRM systems, the request changed, and people said, don't give us this information as a PowerPoint deck. Give it to us in an Excel workbook for two reasons. Number one, an Excel workbook allows us to query the data better than we can if you deliver it as a PowerPoint deck. And secondarily, it allows us to put that data into a CRM system that we've got inside our company. And so in the early 2010s, that's how we were asked to deliver the results, as a flat file, essentially. And in the last 3 to 5 years, I would say, that request has changed. We now receive requests to do the research, and the way people want that research delivered is on a dynamic platform. We don't want an Excel workbook. We don't want a PowerPoint deck. We want this essentially as a cloud-based offering so that people can access it on their mobile devices and on their PCs. And we don't just want to see names of people. We want to see how these people are connected. You know, show me their networks, show me their footprint, show me their sphere of influence. And they want the platform to allow them, to help them target people. And that is essentially how the journey has gone over the last few years. I can't predict the future, but I thought what I would share with you is where we think things are going, because we're picking up signals from a lot of our customers in the types of requests they ask of us. And so I've tried to depict it here. If we look back, I think it's still currently today, you know, we get requests to deliver research in an Excel workbook, still do. Some people are asking for it to be delivered in cloud-based platforms. But now people are coming along saying, we don't need to own this data. We don't see any competitive advantage in having a database of information. Actually, we just want to use this information, and we want that information to be continuously up to date. And so the concept we think is emerging is, let us subscribe to a service whereby we can get this information. We just don't want data, we want analysis. The reason why I put Netflix here is it's one of the most commonly understood subscription services out there, but there are plenty. And what the request is, we want a service whereby we can look at up-to-date data that's continuously refreshed. We want you to use your machine to show us things that we can't find on our own. We want the machine to do some learning and to show us what we can't see. And we want you to do more of this network analysis. We're interested in the footprints, the influence sphere of individuals, and we want to see that and we want to interrogate it. So, not convinced that this is absolutely where the market is going, but that's the reason why, and I mentioned earlier on, we set up another new business called Thecosystems, which is to address this type of approach. If there are people out there who are interested in subscribing to stakeholder data, then we've got a solution. So far, I've got to tell you that it's spotty. We've had some very big companies who are interested in that concept, but mainly it's the smaller startup environment, the small biotechs who don't see any value in spending huge sums of money on buying data. They just want to use it. So there's a summary on that. Another thing that Peter and I talked about when we were talking about this session was to just talk about how do you go about looking at secondary data in order to try and identify who might be the the thought leaders, the influencers, the KOLs in a disease condition. And so I thought I'd put this slide up and just talk to it. As far as I can work out, there are some easy ways to do some research. And when I mean easy, you can automate a system to go and look at publication databases. So on the left-hand side, I think it's very common nowadays that people go out and scrape or download or search PubMed, but not only PubMed, other international databases on publications, and ask the question, who is writing on this topic? I do know that some people just do a simple count and say this person has written 60 different articles in the last 5 years, must be more influential than somebody who's written 30. I'm not so sure the world is as simplistic as that, but that is one approach. Another key source of information is obviously clinical trials, and clinicaltrials.gov is one source, but there are other clinical trial databases around the world, and you can mine that particular source for information. Another readily available source is payment disclosure databases. The most famous and the most, if you like, in-depth is the US one called Open Payments, but there are equivalents here in the UK, in France, and other parts of the world. And I know that an awful lot of organizations go off in that direction to try and find the key people in the world. My only observation with those three, or certainly the first two, publications and clinical trials, is you don't have to be an expert to publish. You don't have to be an expert to do a clinical trial. You just need to be willing, and you need to be fairly keen. On the right-hand side of this slide actually are some other factors which are a little bit more difficult to research, but they start to give you a signal as to whether or not somebody is recognized as a key individual within their community. So for instance, if you're working in oncology, you might go and have a look at conferences like ASCO, and you might say, who are the people who are keynote speakers on particular disease conditions at ASCO or any other conferences around the world? And there are international congresses, regional ones and national ones. Another thing you could do is go and have a look at guidelines. Not easy to do, it's a bit messy to go and get the data, but if you can have a look at international and national and regional guidelines, the truth about that is the people who sit on guideline committees are not people who say, please can I sit on it? They are people who have been recognized by their peers and they've been invited to sit on that guideline committee. I think an external recognition that they have some seniority and some influence in the area. Similarly, with regulatory and reimbursement authorities, we frequently find that when a new drug application is made or a marketing application is made to a regulator, they go out and they get experts to advise them on that particular application. Or when a reimbursement organization is looking at a product, they get experts in the field. And so another way you can try and identify experts is to see who these advisors are. Then you can have a look at professional associations, you know, these learned societies, these very specific subgroups of major organizations, professional organizations. There are people in there who have been elected to specialist groups. And the reason why they've been elected, presumably, is that their peers believe they've got knowledge and expertise in the area. And that's why they sit on the board or the subcommittees of the major professional associations. And then some other things you can look at are patient advocacy groups. I think it's rare nowadays for a company to be thinking about launching a product without first trying to understand who are the patient voices out there in the world and who's associated with those those patient associations. And then there's some other things you can look at. You can look at media presence of people, and you can have a look at different stakeholders' use of social media and digital channels. So I guess when it comes to methodology, you pay your money and you take your choice. You can either look at all of these things or some of these things. And as we observe the environment, that's what we see. We see some organizations picking a handful of these, others trying to cover all sources, and if I may say, some other sources. I'm very conscious that other people look for grants if individuals have been awarded a grant or they've received an award, then those are other, if you like, surrogate markers that people pick on. So that's methodology, and maybe in some of the questions, some people might want to ask me more about that. So another observation, a different view on stakeholder mapping for you is just a little bit more about the current world we're in and where we see some challenges in the future. So I called it the current world. I think 90 to 95% of the people we work with still believe there is value to their organization in conducting research and owning that research about who are the key people in their disease area. So I think the current world is all about data acquisition and ownership. I think the future world is about access, not ownership. Big shift, but for some people, I'm not sure they're there yet. The second thing I've noticed is in different companies, different departments, different functions within departments, different market groups. So for instance, you might find one country versus another country commission their own research to say who are the KOLs in our market or who are the KOLs for our function or our department. It's hugely independent. A lot of money being spent on it, and to be fair, there's a Venn diagram, and a lot of the work done by different departments and functions and markets overlap. And as we look forward, we don't know that that's a wise way to go, and certainly we think that companies might be doing this at a global level and sharing the information across the business, but at the moment it's still independent groups in independent departments. Another thing that we notice is in a number of the companies we work with, there's a hierarchical access. You can do work on who are the stakeholders and KOLs, but you know what? Only certain groups can see it. And so we often find that we are commissioned to do research by, let me say, a medical function, but not all the medical MSLs or others get to see it. Or we get asked to do work for a business analysis and insights group, but not all of the people in the business get to see the data. On the right-hand side, I've used the phrase data democratization. All this data is out there. And if you are not sharing it with some people in your business, I guess people in your business or people in some of the pharma companies' businesses are just spending their own time seeking out this data because it's there. And I think there's a big challenge for people to get their heads around, which is to say, because it's all out there, there's nothing to stop people from getting it. Actually, the only thing you're doing by not sharing it with them is you're costing your business more money because they're going to spend their time and your money doing the research to try and find this stuff. Just going back on the current world, I think a lot of the research at the moment is focused on people. Show me who the people are. And what we've identified is it's not all about people. There are certain institutions, there are certain bodies, there are certain groups who independently as an entity are very influential in the disease area. So just looking for people may be just a little bit too narrow. The one thing I do know about the current world is it's a capital investment to do a lot of work, and because it's a capital investment, people don't update it on a regular basis. And just contrasting that with where we see the future, we actually see, data democratization. Everybody can see this stuff. Everybody should have access to it. The methodology by which it's been created should be transparent. The data should be dynamic. It should be updated regularly. Not necessarily on the fly, but regularly, monthly, quarterly. The data should be connected. There's no reason nowadays to have just an Excel file with flat data. It can be connected and it should be connected. It needs to be on mobile platforms. We've done a lot of research on where are people accessing the information we make available, and now 60% of all of the access to the platform that we deliver is coming from a mobile device. So telling us that people are sitting, I don't know, on a train, in a plane or somewhere, looking at it on a tablet or on their phones. And the future also, in our view, is machine learning. Somehow or other, I'm not sure I understand artificial intelligence fully, but somehow or other, people are expecting machines to do some of the heavy lifting and to guide people to learnings that they couldn't find themselves. So there are some observations about some dynamics that we think are going on in the world. I think I've just got one more slide, and that is, you know, we have a phrase inside our business, which is, what's the unvarnished truth? What's really the nitty-gritty when it comes to our area? And I thought I would leave these four with you for discussion. When all this information in the public domain is out there, why don't people in the business just Google it? Okay, and I often get asked that by clients. Why don't we just Google it? Let our MSLs Google it rather than invest in this type of work. So we sat down with a client and we got their MSLs to actually calculate how much time they were spending Googling some of the key people they were going to meet and talk to before they went out to meet them. And it was anything between 30 and 45 minutes per person that they were spending researching that person before they went to go and meet them, for ad board meetings, for conference meetings. When you add that up per MSL, per KOL or stakeholder that they're visiting, the amount of time the company was investing in MSLs doing Googling, it turned out that Google's not free at all. It's actually incredibly expensive. The second thing I would say to you is, the phrase we're often asked is, show me the influencers. My concern is, I don't know who's an influencer. I can tell you who's got credentials, but whether somebody who's highly credentialed is actually an influencer, I can't guarantee, because secondary data tells you about what people have done. It doesn't tell you about their personalities. It doesn't tell you about their communication skills. It doesn't tell you about their character. And saying to somebody, do some research and show me who's the influencer, I don't know you can do it. I know that you can find somebody sitting in a room, and when they're asked to give an opinion, they're incredibly influential, and yet they may not have many credentials to their name. So this issue of show me the influencers is a difficult one, and I think we all may actually have to address it. The third thing I would say to you is, as I've mentioned earlier on, data democratization. It's a challenge. Senior people in businesses still have a view that if they own the data, they've got knowledge that other people don't have. And yet, all of this stuff's out there, and how do we address that? And then finally, data privacy. As we all know, GDPR has hit the UK, but then there have been other things around the world, the Japanese with their Personal Protection Act. Data privacy is going to continue to be an issue. We clearly are GDPR compliant, but I think as time goes on, that's, different rules are going to come into play, and we are all going to have to adapt to individuals' data privacy requirements. So those were some thoughts that I thought I would leave, Peter, and swing it back to you, really.
Thank you very much. Just flick up your last slide, which gives you contact details, Peter, and then
Yep.
we've captured that, and then anybody can contact you afterwards. But then if you could close down your slides, and then we'll just be talking on our own. So thank you very much. I thought that was excellent, very, very comprehensive, and it covered a whole bunch of topics that we could pick up. Can I, and I would invite the audience who's online at the moment, just a reminder, you've got two buttons at the bottom of your screen. One's a chat button, one's a Q&A button. Use either to send in your observations or your questions, and we'll pick that up and talk about that as a little bit of discussion session. Could I ask Peter, well, I'd like to start with, I've got two questions I'd like to throw in. One is, we talk about KOLs. I'd just like to touch on this, and it might provoke a response from the audience as well. But I think recently you were part of a meeting which was talking about the sort of terminology that's used. KOLs a couple of years ago, it was all very much like we don't talk KOLs. That's you're using that terminology. Are we all using that terminology now? Is it a sensitive point? Have we got to be careful about quite what we call people? In fact, someone's just sent in a text message known as KOLs or key thought leaders. Just briefly, because I don't think that's the main point in this. But what's the position on the terminology we're all supposed to be using?
It's all over the place, Peter.
Okay.
It's literally all over the place. I've been in a few meetings where people are congregating around KOLs, but key thought leaders, key external experts, stakeholders, you name it. It's all over the place. I can't give you one, but the most commonly, if you like, historically accepted one is KOL.
Okay, so so let's just accept that we'll talk KOL, okay? Although there might be some discussion with some people. My second question, which I'd like to throw in straight away, is that I mean, how do you test? How confident are you in the robustness of the data? So I was actually caught out in the last few days. I've been informed that somebody I'm linked to on LinkedIn, who looks like a sensible, experienced agency person, it's a completely false profile. There's nothing to do with the agency involved and so on. There's a lot of obviously predatory journals, predatory conferences and things out there. If this is just computers going out, as it were, and trawling this data, and how does it distinguish between the editorial board of a predatory journal where they may not even know they're named, etc.? Can you just help me a little bit understand what there is in there to control that, but also the sort of problems that must inevitably happen with that?
Yeah, I mean, there are problems, but it depends on the process that an organization goes through. So we actually eyeball the data. I know it's a bit old-fashioned, but we do eyeball the data, and that's one of our validations and verifications. Strangely enough, GDPR is a very good validation as well, because we now have to write to everybody in Europe and let them know that we've got their details on our system that we've created here, and we therefore can validate the email address, and we can validate that information. So there's a bit of that as well. When you come to predatory journals and predatory conferences, I've got to say to you, I'm truly not sure that everybody that you would imagine understands the issues with relation to predatory journals and conferences are aware of them. Quite frankly, I just don't think they're aware of them. And I know from some other people who do what we do, when I was talking to one of them about a predatory journal, they didn't even know what it was. So I think, again, you have to ask about the methodology, and you have to see what are people doing and test them. But I can't offer more than that, really.
So to ask a specific question, within your system or your approach, can you or do you specifically take lists of predatory journals and say we will not search those sites? Because, as I say, the classic situation is Professor X or whatever, without even realizing it, has been named on an editorial board. I mean, that if you just look at that, you go, oh, that's impressive. Actually, that's completely misleading. So can you say, following journals will not be looked at? Is that how it works?
Yeah, to our pain, I've got to say, we do not consider predatory journals. And we were working for one client, and they actually published a lot in the predatory journal, but we took it out. And our view was, if they are not afforded a GIF factor, by PubMed, and if they are on a blacklist somewhere, we're not going to put it in. And that's how we go about it.
Okay. So several of the questions that have come in are all around GDPR.
Sure.
So I guess we might as well, he says with a slight nervous laugh, talk about GDPR specifically for a minute. You can see the questions there, Peter. How are you currently dealing with GDPR based on current regulations? With this shift, what's happening with GDPR? What are the sort of issues? You've mentioned, I think, that you actually email everybody that you have in your system. I mean, clearly that's fine. However, what you're not saying is they have to answer and say, that's fine. So presumably there is an area in there that somebody could say, I don't want to be part of your system, for instance. Is that?
Absolutely, yeah. So shall I try and answer some of these questions then, Peter? So I one from Martino, which is, how much is this shift from data acquisition to ownership determined by GDPR? I don't think it is, Martino. I think it's economics, and I think it's just a change in mindset in the world that why buy something and make a capital investment on something when in actual fact you don't have to own it, you just have to use it well. So I don't think that's been driven by GDPR. Another one's asking, how are you currently dealing with GDPR based on current regulations? Well, the answer is we put ourselves through an audit by a legal firm, specialists in data protection and GDPR, and not only GDPR, but as I say, some of the other international personal information protection acts around the world, and we follow that procedure. So for our business, we write out to everybody, every European subject, to let them know that we have curated their data in relation to a disease area, and it sits in a database. We give them the ability to access that information so that they can see everything. They clearly have the ability to modify, redact, or actually ask to be removed from the database. We've now done over, well, 6 figures, I think maybe 150,000 of these emails to different experts in Europe. We've had one request for a removal, and it was from a German pharmacist. I think the issue here is when you are dealing with experts in a disease area, they want to be known by the world, and they want the world to know that they are an expert. And so as long as you treat it properly and professionally, I don't actually think they have a problem with being recognized as an expert. Another question was, without giving away your IP, but if a client says, I want KOL mapping, please could you talk through your stepwise approach to getting this project off the ground? Well, very, very simply, we would sit down to say, what is it that you want to be able to do at the end of this project? Big questions are, what's your geographic focus? What type of stakeholders are you interested in? One of the other questions was, do you look at primary care, nurse practitioners, and others? This is a big deal. As I said in my earlier comments, I think a lot of KOL work has been on physicians, essentially working on that very old-fashioned principle that if you talk to the doctors will tell everybody else what to do and everybody else does it. Nowadays, actually, it's not just the physicians, it's the health economist, it's the nurses, it's the pharmacists, it's the patient advocates, it's the, we've got a project yesterday where the company wanted to identify nurse practitioners, nephrology nurses, physician associates or assistants in a couple of different countries. So it is a wide range of different stakeholders. And so another question is who are you interested in? What types of people are you interested in? We would then go away and do the initial research. We'd sit down with the client and say, this is what we found. Now let's refine it. Can I say in years past or in months past, KOL mapping used to be sold by the yard. People would say, I want 100 or I want 200 KOLs. I'm not entirely convinced that that's a smart way to operate, because you end up throwing some people off the list of 100 or 200 because they don't meet certain criteria. The truth is, they make up the ecosystem for that disease area, and they may only be active in one type of activity, but when that activity is important, they have a very big voice in that disease area. So our view is, let's not try and do this by the yard. And then we would go ahead and profile these people, and then we'd put them into a platform that they could manipulate, access, and understand. Another question was, how do your approach differ between identifying KOLs and identify rising stars? Good question. You can look at rising stars from a number of different levels. One of them is to do some analysis, do some trend analysis, and ask questions like, show me people who have matured in the roles that they've played in clinical trials, in publications, and in congresses in recent years. Is there a noticeable development of their seniority in the area? That's one way of doing things. We've actually got a little checklist that we've developed over the years that's a soft checklist. We can identify KOLs if they meet certain attributes. I'll give you an example. An emerging leader, more often than not, has worked with a KOL at some point in their career. They've worked in a center of excellence at some point. They've had international exposure in their education at some point. They work within certain institutions. Can I say they graduate from certain medical schools within the country. I think we've looked at lots of different countries around the world, and in most countries there are a handful of medical schools that generate over time a larger proportion of KOLs. So we've got a checklist of some soft measures that we look at, and we bring together analysis of the data with a soft list check, and we see, can we signal that these may be future rising stars?
Sorry, I'm just going to slightly butt in there because we're getting a couple of questions coming in that again we might get a bit bogged down in. I've got one eye on here. Could I just to sort of wrap up this part of the session, and sort of the formal part of the session, say, can I just pick up on one question that did come in about mapping for countries with restricted web resources like China, and maybe that would just be a good little one to finish on. And there's a couple of other questions there which we can talk about after we stop the recording. But what's about places like just the simple? Again, it's back to the simple. How do you get some of this data? And the accuracy and so on.
Okay, well, quite frankly, when it comes to China, we adopt the following approach. We try and do research from the UK or from the US, which is where we're based. We have found that we have not been able to access some of the sources of information in China from outside of China. So then we do research from either within China, and we've got some partners in China, or we do it from Hong Kong. And we've been able to access it. The only thing I would say is, if the data's not there, you're not going to find it. So it's true to say that in China, the extent of the information available is less than you might find in Western Europe. But the same is true, if I may say, of Latin America. The quality of the web services down in Latin America and the availability of those services in Latin America is not often as good as it might be in Western Europe or North America. So I think if it's there, there are ways of accessing it, but it all depends upon if it's there.
Okay, I'm going to draw a line on that formal part of this session, if that's okay with everybody. There are a couple of the questions there, and for those of you online at the moment, we'll carry on talking. That's not a problem. But for the purposes of the video, as it were, can I just draw a line? Can I say a big thank you to Peter, because I think there was a lot of really useful information in there and ideas in there which people can pick up on. And Peter, to state the obvious, yeah, I hope I'm stating the obvious. You're very happy for people to reach out via LinkedIn and the likes and to talk to you, okay? So as I say, on that note, can I just call a halt to this bit of the meeting and say thank you and bye-bye to everybody, as it were. So we could give a little wave, Peter.